Afternoon, and thank you all for joining us for the NMQF's annual summit. My name is Nicole Varner, and I currently serve as the Executive Director of the Congressional Black Caucus's Health Brain Trust under the direction of the fabulous Congresswoman Robin Kelly. I'm so glad to be here with you all today, despite our challenges with COVID-19, and I appreciate you taking the time to be with us. As we all know, healthcare was a major issue for voters during the 2018 midterm elections, and House Democrats were able to pick up a majority in the House because of people's desire to have access to affordable healthcare. And now, because of COVID-19, the 2020 election will focus on healthcare more than any election before, especially with the ACA lawsuit coming before the Supreme Court next month and the recent passing of Justice Ginsburg. Our panelists are here today to give us their perspective on the political landscape, to discuss the biggest issues on the ground, what they're hearing, as well as how they're campaigning and contributing. Finally, they'll give their 2020 election projections and discuss the policy implications that will follow as a result of the election. I would like to take this opportunity to introduce our panelists. First, we have Congressman Mark Vesey, my former boss, who represents the Dallas-Fort Worth area in Texas. He has been in Congress since 2013 and sits on the powerful Energy and Commerce Committee. Previous to coming to Congress, he served in the Texas State House. Congressman Vesey is an advocate in Congress for Medicaid expansion and ending health disparities. He is also a political whiz. The man knows his history backwards and forwards. Next, we have Mike Mckay, founder and managing partner of Empire Consulting Group, a government relations firm based here in DC. A friend of mine who I've had the pleasure of working with on a number of healthcare issues across the board. He has mentored many Capitol Hill staffers, including myself, and is a definite player in the political realm, using his vast institutional knowledge to work on both sides of the aisle to find common ground. Next, we have Preston Kolkarni, who is running for Congress in Texas's 22nd Congressional District. He is the son of an immigrant father from India and a mother from the family of Sam Houston. When his dad was dying of cancer, he came home from the University of Texas to care for him. And when the medical costs left his mom on the brink of bankruptcy, he helped raise his 3 younger siblings. He served our country overseas as a foreign officer for over 14 years in places like Iraq, Israel, and Russia. And when he saw how divisions, extremism, and hatred were tearing this country apart, he knew the most patriotic thing to do was to come home and fight for the values that unite us as a nation. Last but not least, I would like to introduce my friend, Jalisa Washington Price. Jalisa currently serves as Vice President of Political and Advocacy for iHeartMedia, as well as the political advisor of Vice Presidential nominee, Senator Kamala Harris. Prior to joining iHeart, Jalisa served as the South Carolina State Director and National Deputy Political Director for Senator Harris's presidential campaign. Jalisa is a political veteran and has worked a number of congressional and statewide campaigns, mostly in the Southeast. She has held senior leadership positions with the Democratic Congressional Campaign Committee, or DTRIP, and Hillary Clinton presidential campaigns. During our discussion today, I encourage you to put questions for our panelists into the Q&A box, and I'll try to read them and get answers. With that, I'll kick it off to you, Congressman, to start with introductions.
Oh, well, thank you very much. Is it on me, Nicole? Thank you very much. I appreciate it very much, and just great to be on the panel today, to be able to talk particularly about healthcare. For me, healthcare is important because of the district that I represent, and having worked in my office, that the district that I represent has the highest uninsured rate out of any congressional district in the entire country. We have about a little more than a third of the constituents here, according to the 2010 census, don't have health care, and that's obviously big because it affects everything else that encompasses them not having health care. So you look at their reliance on FQHCs, their reliance on our county health care systems, which I represent too in both Dallas County and Tarrant County, Parkland and John Peter Smith, respectively. And just being able to treat their families, and a lot of these ailments particularly that we see around COVID-19, that they say makes people more susceptible to catching it. I mean, think about that for a quick second. Diabetes, heart disease, high blood pressure, other comorbidities that could put people at higher risk for COVID-19 are usually overrepresented in constituencies that don't have healthcare insurance. So, for me, being a part of the panel today is hugely important. And I just appreciate you allowing me to share my voice on this topic that I think, we've made a lot of strides since ACA. We've had some setbacks with the Trump administration trying to, for instance, make it harder for people with pre-existing condition to be able to have affordable health care. But we have to keep moving, because I do think that this, outside of this hiccup that we've had since 2017, that we're moving in the right direction because of a lot of the policies that are being set forth within the Democratic caucus here in DC and Democratic constituencies around the country. So thank you.
Thank you, Congressman. Mike?
Thank you, Nicole. Congressman, always good to see you, Congressman VC, and the great work that you do. And obviously, CBC Brain Trust Chair Robin Kelly, Congresswoman Robin Kelly, she is just fantastic. I'm just excited to participate and honored that you guys asked me to participate in this panel discussion today. She's done great work as chair of the Brain Trust and the great work that NMQF does as well. The Congressman said it so eloquently. Mike Mckay, Empire Consulting Group, we're an African-American firm that does government relations and public affairs and represent a wide variety of different clients. And having worked with the Congressman VC, Nicole, Brandon, through the years, certainly healthcare is going to be the defining issue, laid on top, obviously, of coronavirus. Coronavirus is going to accelerate if it couldn't be accelerated anymore. And then to the Congressman's point, when the Supreme Court takes up the ACA, I believe it's November 10th, is the day they're looking at begin after the elections. But that's certainly going to propel, since I think, in all due respect, Congressman to be your Attorney General is one of the Attorney Generals leading the lawsuit for the ACA to get rid of, not to sound partisan, but it's just true, to get rid of pre-existing conditions. And I think, like the Congressman said, when you have diabetes and other health ailments that afflict the African-American and Latino community, that's going to be brought to light with because of coronavirus, obviously, and if ACA is scrapped by a Supreme Court. So again, I'm honored to be here. It's always a pleasure to work with you and to be among this distinguished panel with my colleagues, and thank you for the opportunity.
Thanks, Mike. Mr. Kolkarni?
Well, thank you very much. It's an honor to be here with NMQF, and especially with Congressman VC. You've been a great mentor to me, because I did not have a background in politics. In fact, I didn't expect to be here today. I grew up in a very humble family. We started out life in a 2-bedroom apartment with 9 people, and the kind of struggles that our community is going through, the same struggles I faced growing up, having to bus across town to get a better public education because we don't have equity in education across zip codes in this country, experiencing crime, a broken criminal justice system growing up, witnessing gun violence personally with my family. And then, of course, when I was 18 years old, as you mentioned, Nicole, my father got struck with acute myelocytic leukemia. I was at the University of Texas at Austin, and I had to come home, drop out of school, and take care of him, do his physical therapy, his IVs, take him back and forth to MD Anderson as he suffered through a bone marrow transplant. And unfortunately, he didn't make it. When I was 19, I lost my father, and my mother was on the point of bankruptcy, taking donations just to stay afloat. And I want to make sure that that doesn't happen to any families ever again, because it's still the #1 cause of bankruptcy in this country. And I think that's unconscionable in a country as wealthy and developed as the United States of America. My family has a strong tradition of patriotism, and I decided to serve our country overseas in the Foreign Service in places like Iraq and Russia and Israel. And I would have been serving overseas today if not for what I've seen happen over the last few years, the attacks on Barack Obama's birth certificate, the attacks on Latinos, saying that a Latino judge couldn't be fair, the attacks on the Muslim community, calling to ban all of them from the United States, and then finally the Charlottesville Nazi rally in 2017, that's when I decided that things had gone beyond right and left. We're just talking about issues of right and wrong. So I resigned from the Foreign Service and came home to fight for those values that do unite us. And what I found out is that our district, which used to be Tom DeLay's district, by the way, was one of the most solidly Republican districts in the country. It was also the fastest growing district in the country. We're now the largest district by population, over 935,000 people. We're 50% college educated and we're 60% people of color, but we had never been represented by a person of color in our history. And the reason is this: not all communities were being reached out to. So we set about to run the most inclusive campaign ever in Texas history and hopefully American history. We reached out to every immigrant community. I speak 6 languages myself. We are now campaigning in 27 different languages, which has never been done in Texas or American history. And we reached out to every faith community, every ethnic community here, because every community deserves to have a voice and a seat at the table. And by doing so, we brought out 30,000 new people who hadn't voted for president in 2016, but they came out during a midterm election to vote for Congress. And we almost flipped a seat that wasn't ranked in the top 100 races in the country. And since then, we've registered over 60,000 new voters in our district alone. Our incumbent congressman dropped out of the race. Now we have an open seat and we're ranked by National Journal as the #3 most likely to flip red to blue from not being in the top 100 2 years ago. And with regard to the challenges that we face, they've only increased in the last 2 years. We know that coronavirus and the pandemic is the #1 challenge that we have faced in our lifetimes. But even before that, the disparities in healthcare that we saw, the costs that burden my family and burden families of all backgrounds, of all political stripes here. We know that we need to bring down costs. We need to increase access for people, and we need to deal with these inequities, which have only been exacerbated by the coronavirus. The pandemic that we're facing is not a red or blue challenge or a Democrat or Republican challenge. It is a national challenge. But I believe that our district, Texas 22, the most diverse district in the country, is the one that should set the example of how we come together and unite in the face of our greatest challenge, not divide.
Thank you. Jalisa.
Thank you, Nicole, and thank you so much to the leadership of NMQF for having me on the panel today. It's a pleasure and honor to be on a panel with Congressman VC. We all just admire his leadership in DC, and it's just an honor to be here today to talk about healthcare. A little bit about myself, as Nicole mentioned earlier, I am currently the VP of Political at iHeartMedia, as well as pulling double duty, serving as political advisor to Senator Kamala Harris on the Biden-Harris campaign. And I am also 8 months pregnant. So like everybody, I'm doing everything I can to make sure we turn out voters this election cycle, and healthcare is the #1 issue that will turn out voters. We saw it in 2018 when I worked at the DCCC. Healthcare really was the #1 issue that helped us flip the Congress in 2018 election cycle. And we're also seeing it this election cycle on top of the coronavirus pandemic that we all are sitting in. Folks are really scared, and folks are really concerned about what is to come in this country. And it's very important. And again, I'm very honored to be having this conversation around healthcare and what impact it's going to have on this election cycle. So I'll turn it back over to you, Nicole, so we can get started on this conversation.
Sure, of course. And before we kick it off, I have a poll question for the audience, and you all please feel free to weigh in on the question. Given the rush by the current administration to have a COVID vaccine available by Election Day, if the vaccine becomes available, how do you think it will sway voters' opinions on Election Day? Do you think voters will be more likely to vote for Trump, more likely to vote for Biden, or do you think it will not have an effect on voter opinions? Any thoughts?
Is this for us? Yeah.
I mean, yeah, you're welcome to answer.
Okay. I don't think it's going to have any effect. Unfortunately, the president has politicized the rollout of this vaccine. There are manufacturers that are racing to bring a vaccine to the marketplace, and absent the politics. But unfortunately, the president, with his tweets, with his remarks, has politicized this so much. And look, obviously, and for full disclosure, I just got my flu vaccine shot yesterday. So if you haven't gotten that, please, I encourage everybody to do so, because this season is supposed to be really, really bad. But while vaccines are safe, because of the trust barrier that this president, when you lie 20,000 something times, I don't know the exact number, but obviously just yesterday or late yesterday, he said that the flu is the same as the flu is the same as the flu is worse than coronavirus. It won't have any effect.
I would agree with that. The basic question here, and honestly, it's not a matter of whether we're Democrat or Republican or liberal or conservative. Do we believe in science? And science does not go on the timetable of an election. You cannot say that the coronavirus will just disappear magically. And as we've seen from vaccine manufacturers, they don't want to be liable for putting something out there before it's gone through testing. So I think we need to reinforce that actual clinical trials, vaccines that have gone through the entire process, should be taken, and we should be able to distribute it effectively and safely to our entire population. But these are things that cannot be rushed. They cannot be put on a political timetable. That's exactly what we shouldn't be doing. We should not be playing politics with people's health and people's lives. We need to believe in science, which is about evidence and a shared reality for all of us.
Yeah, no, I think that that's right. And, I think what Ms. White was saying earlier, I think that people are paying attention to whether or not we're going to go back to the days where people were put in high risk pools and had to pay exorbitant costs or couldn't get coverage at all because they had pre-existing conditions and having those protections taken away. I think that Trump has politicized this vaccine and everything around COVID so much to the point to he can make a big announcement about a vaccine, and I don't think that it will play any role whatsoever. And just from all of the different discussions that I've been a part of, and I've heard, hours of testimony from Dr. Fauci and Dr. Redfield serving on Energy and Commerce Committee, and just calls in general, caucus calls in general, like talking with those two gentlemen and other people that brief members of Congress, and the likelihood that you're going to have something that can be deemed to be safe and effective before November the 3rd just seems highly unlikely. I think that the American public, for the most part, respect and understand that, these vaccines take a while to roll out. And if you listen really closely, what Dr. Redfield said in his testimony, that even after the vaccine, comes out in Q3 or Q4 of next year in 2021, that he would actually still feel safer wearing a mask in public. And so that should tell you a lot about where we're headed, and the fact that being able to come up with a vaccine that's going to just instantly cure everything and have us go back to normal, that may still be some time away. And Dr. Redfield didn't want to just come right out and say that, but the vaccine that we do eventually get could be something that could help us mitigate the effects of COVID, but not necessarily just make it disappear and go away like we would all like to see.
I agree 100% with everyone's saying. I mean, since the beginning of this pandemic, this administration has eroded trust in this whole process. And I think voters are, first of all, we've already started early voting in a lot of these important states around the country. And folks are going into the ballot box knowing that this president has lied about so many things around coronavirus. Even I'm in South Carolina right now, quarantining with my family. And just the conversations folks are having around, is the president lying about having coronavirus himself? When have we ever heard or had people be skeptical of the president being honest about his health, right? And I think, the vaccine is just another thing that is going to have people leery. And until the health experts come out and give clear instructions, I think this president coming out with a vaccine or a timeline about a vaccine isn't going to do much for him.
Can I just add one? Go ahead, Congressman. Please.
I was just going to add to the point. I think what Dr. Redfield said is that this can actually be more important than a vaccine. Just the fact of wearing masks and the fact that people have politicized this so much. I still, for the life of me, can't understand how wearing a mask hurts anyone's family, how it should be a right or left, Republican or Democratic issue. It's just about respect for other people, about concern for people in our community. And I think all of us need to make sure that we're setting the right example from the top all the way down, that this is the best thing, the safest thing, the easiest thing that everybody can do right now to protect our entire communities.
Yeah, the one thing I want to add to my remarks briefly is clinical trials, and diversity in clinical trials is very, very important for our community to make sure that any vaccine that is brought to the marketplace we're included in that. And the important part is to making sure that folks from our communities participate in these clinical trials. The one thing I would add, though, is that as this gets rolled out, as this process continues along, you need trusted community validators like Congressman VC, like Shri, Congresswoman Robin Kelly, other elected officials, HBCUs, what roles can they play in this process? Validators that, since there's so much skepticism because of the president's constant stretch of the truth, or let's call it what it is, lying, that what are other community validators that can sit here and say, hey, you know what, these vaccines are safe, that's coming to the marketplace, and that you should participate in these trials.
You bring up a really good point, Mike. But before we continue, let's see what the audience thought. So it seems that most people in the audience thought that the vaccine availability will have likely no effect on voter opinions come election day. And it was tied 16-16, whether more likely to vote for Trump or more likely to vote for Biden, according to the audience poll. And to piggyback off of what you just mentioned about clinical trial diversity, Mike, yesterday there was a fantastic panel hosted by the NMQF with members of the Divine Nine sororities and fraternities who are featuring professionals from across the spectrum that are involved in clinical trials. And it was a phenomenal panel. If you haven't seen it, please check out the recording. It's up on the NMQF website. So I want to swing to something that Jalisa mentioned when she was talking about our poll question. And she mentioned that a lot of our states are early voting right now. And so I want to ask, are there particular states that you think will have the biggest impact on the election based on the health disparities they have faced during COVID-19?
Well, I can start. I think clearly this is going to have an impact on Texas. I mean, healthcare was the #1 issue in 2018. It is absolutely, without a doubt, the #1 issue in 2020. And, you know, first of all, we've had 650,000 people who've lost their healthcare this year alone across Texas. And that's before the ACA lawsuit, which is going to be heard a week after the election. So people in Texas know what is on the ballot. Their health is on the ballot. Our economy is on the ballot because 1 in 6 small businesses have failed this year. We've got 50 million people who filed for unemployment because we can't control this coronavirus pandemic. And the education of our children. Families come to me every single day worried that they don't know whether it's safe for their kids to go to school or not, and they don't know when they will be able to go to school and get a proper education. So it's affecting every aspect of our lives. But even after we get past the pandemic, these issues that we were dealing with before of cost of healthcare, of the bureaucracy in healthcare, some of which have changed during the pandemic. So for example, access to telehealth. Now that genie is out of the bottle, and I think it's going to improve access and delivery for healthcare for lots of people. But then expanding access across the board. The fact that Texas did not expand Medicaid, that disproportionately affects certain communities. So for example, in our district, the Latino community is 27% of our district, and they have 4 times the average poverty rate. The lack of Medicaid access, the lack of expansion of Medicaid, that's literally playing political games with people's health and their lives, and we can't continue to do this.
Yeah, I think that it's going to have an effect everywhere. I don't know if you can particularly say that that all of this is just going to play like in a certain state or a certain county. I think that you're going to see areas that have been solidly Republican, and for a lot of different reasons. Maybe it was because they were already trending that way anyway, like in the case of the district that Shri represents, because there's been great diversity. But I also think that in states like, for instance, where Ms. Price is in South Carolina, that you look at how well Jamie Harrison is doing, which is absolutely amazing when you look at the historical election totals going back the last several cycles in South Carolina, and Democrats just haven't fared well there at all. I mean, it's just the Republican primary had been how you got elected statewide, and you look at what Jamie is able to do and capitalize on, and a lot of that I think is because of the fact that Trump has bungled the response to this virus, and also has played games with people's healthcare on things like pre-existing conditions, to where I have people that were Republicans that will come up to me and say, when I'm back here in Fort Worth and Dallas, and they'll say, hey, I'm now rethinking my vote because I have a daughter that has pre-existing conditions. And when it comes to dealing with our public health, the president has just failed over and over again. And I think that doesn't mean that we're necessarily going to carry all these states, or we're going to necessarily do well in all of them. But I think what it does mean is that you're going to see us do better than we ever have before. And you can see that with a new CNN poll that just came out that just had Biden up by 16. That would be the biggest win that anyone has had in the presidency since Nixon in 72. It would be absolutely amazing. And so that means that you're going to see Republicans and Trump lose ground, even in areas that have been just very safe for them in the past.
I told you Congressman VC knows his history backwards and forwards.
No, I was just going to, reiterate everything Congressman VC said. Jamie Harrison in South Carolina, we've never seen a race like this, and I know in my lifetime in South Carolina, and we're seeing it even throughout the South. You look at states like Georgia, Florida. I think the failure to the response of COVID, the COVID pandemic in this country, really are having people readjust their thinking around the Republican Party. And even when, as we talked about early, the expanding Medicaid in a lot of these southern states weren't done. And now people are feeling the crunch of that. And I think, like Mr. VC said, I don't think we'll get a sweeping win around the country, but I think we will wake up on November 4th and pick up a lot more seats in the Congress and win some statewide seats that we weren't expecting.
Speaking of South Carolina, that's kind of where Biden, or Vice President Biden, got a boost from Black voters. I know, Jalisa, you were down on the ground during that time. How do you see minority voters, especially Black women, driving the outcome of the election statewide and the presidential? And what health issues do you think will be most important to them, especially given the recent death of Justice Ginsburg and the potential replacement in Amy Coney Barrett?
Great question. One of the things that I commended a lot of the Democrats in the primary for talking about, particularly talking about Black women, were maternal mortality. This is an issue that has affected Black women, prior to the pandemic, but we're actually seeing, a rise in maternity mortality among Black women and women of color around the country. Black women are 2.5 times more likely to die from pregnancy. And this is a big issue that, that they care about and we care about. So that is going to be on the ballot come November. Also, too, when you think about Black women in this pandemic, not only are we disproportionately affected by coronavirus, when you think about the economic impacts of us losing our jobs and small business, people, someone mentioned earlier about small businesses being closing around the country, the economic impact of losing the health care that you may have had on your job is also going to be on the ballot and is going to be a #1 driving issue for Black women and women of color. And when you're thinking about reproductive health care, it's a huge issue. And we're seeing it play out now with the nomination of Amy Barrett. So it'll be interesting to see how many people will turn out to the polls when it comes to reproductive health care and the threat of reproductive health care. So, Black women have been the backbone of the Democratic Party and just, of the voting system. And I think you're going to see them turning out in record numbers, but also bringing their family to the polls in record numbers too. I've been on social media since early voting has started, and just seeing the pictures and the videos of the long lines of people who are early voting. And I do believe Black women are making, their family and their kids come up to the polls and vote this election cycle. So they will be number one driver this cycle.
Does anyone else have a perspective on the role that minority voters are going to play in the states?
Absolutely. So, I mean, Texas overall is a state with 60% minorities, and it's not represented that way in our state government or in our federal government. In Austin, for example, the GOP is 96% white in a state that's 60% people of color. But I think you're going to see record turnout from all communities of color this year. As I mentioned earlier, the Hispanic community has been disproportionately impacted. They're the most underinsured group in the most underinsured state in the country today, Texas. But as we mentioned, women of color are disproportionately impacted by these attacks on reproductive health services, including during the pandemic. Some of our politicians, our elected leaders, have used this as an opportunity to try and take away access to reproductive health care services. And we know that affluent women, white women will always have access to reproductive health services, but it's low income women of color who are the ones who are disproportionately impacted, who are literally dying because politicians are playing these games with their lives. And I think you're going to see a record turnout because of all of the issues we've seen this year, especially around racial equality. As many of you know, we buried George Floyd in our district in Texas 22 in Pearland a few months ago. And the numbers of people that you saw in the streets, we were talking about this before the panel, 60,000 people in the streets of Houston, but 200 people in the streets of Vidor, Texas, which was the capital of the KKK here in Texas. We know that racial equality across all areas, across education, across economy, and especially across healthcare, all of those things are on the ballot. And I guarantee you're going to have record turnout in Texas this year.
I agree with that. I think the minority vote, first of all, African-American women, as Jalisa said, are the base of the Democratic Party, and it's not even close. But when you put in African-Americans, Latinos, Asian Americans, and you just lay that on top of the comments and just the hostile attitude coming from the president over the last 4 years, I think it's going to be record turnout. Early this morning, I saw lines long. It's early voting started in Ohio, and I think it was CNN or MSNBC showed the lines long for people to register to vote. Same thing with Milwaukee. Florida, to the previous question, the Congressman VC has always said to me that Texas is going to turn blue, okay? And I don't doubt anything the good congressman says, unless it's something related to the Dallas Cowboys. He's my good friend. Having said that, though, and he knows that. Having said that, okay, if we win Texas, like Shree said, if we win Texas, game over. If we win Florida, game over. There's no path for the president to get to 270 unless he's flipping New York or California, which we all know it's not going to happen, right? When you look at other states such as Arizona, again, Maricopa County, with the Hispanic vote, you win that. I mean, as Congressman VC knows, his good friend, the former Congresswoman, now Senator Sinema, ran up the score there. She's in the United States in an off-year election. And if Biden, if all projections well, Arizona is a state we're going to carry. I think I know I'm going to get my hands chopped off of this, but I don't even think it's going to be close. I think it's going to be an electoral landslide for Joe Biden.
So you and Mr. Kolkarni and Mr. VC have talked a lot about Texas and Florida and Arizona, areas where we know that there's a huge population of Latino voters, but we also know Latino voters traditionally have not turned out in the numbers that we would like them to, or that they want to. And can you guys kind of talk to why that is and what, we can do to kind of spread word to this demographic of voters who is affected at almost as high a rate as Black Americans, in health disparities, in income, in just about any disparity that you can think of. How do we get the message across that, you can vote, don't be afraid, how do we convey that to them?
Yeah, I think that what I hear from the Hispanic constituency that I represent is that they would like to hear the Democrats specifically address their community more on a wide range of issues. And that's hard to do because the media really focuses a lot on immigration. And so that's tough to do. But if you are a fifth generation, Mexican American, Texan, you probably want to hear immigration may still be important to you, but you may want to hear more than just immigration. And so I think that it's important that that culturally that we go into communities and listen more, regardless of what race they may have, and find out what all the issues are that are important to that community, and not just assume that the only issue that is important to them is for instance, like immigration, or in the Black community, not to assume that police reform is our number one issue. There may be other things that are important to us. I know that, like, for instance, when we talk to young Black entrepreneurs, they want to talk about access to capital. That may be the thing that's driving for them. And so actually going into communities and finding out what is important to them, I think is going to be key. And I think also understanding the differences between the Latino communities. In Texas, it's heavily Mexican American. In New York, where Mike is from, it's more Central American, Puerto Rican, and what have you. In Florida, it's Puerto Rican, Cuban, and Venezuelan. But here it's Mexican American. You go into South Texas, for instance, and you go into Phil Vela's district, or Vicente Gonzalez's district, or some of those other border towns. And for the Mexican American culture there is much more conservative than the Mexican American culture here in Dallas, Fort Worth, or like say in Houston, where people there are, gun owners, very devout Catholics. And so their views of the world is much more different and much more reflective of rural Texas versus urban Texas. And so I think just understanding those key elements within the Latino community and the key differences is huge and important too. And I don't think that it's always been done from what I can see.
I would like to echo those words of wisdom from Congressman VC. What we found in our district is that the way to get people to vote after millions of dollars and years of research is to talk to them, to have these conversations, and to make sure that you're not treating any community as a monolith, because none of them are a monolith, whether the Latino community, the Asian community, African American community. What we did in 2018 was we didn't try to treat all Asian voters, for example, the same, because there's no such thing as an Asian voter. We had volunteers in the Chinese American community, the Vietnamese American community, even within the Indian community. We had our lists and our volunteers and our voters separated by the language they speak, Gujarati or Telugu or Kannada or Malayalam, or by their faith, Hindu or Sunni Muslim or Ismaili Muslim or Sikh or Parsi or Jain. And by doing that, we organized each one of these communities individually, and we were able to double the turnout of the Asian American community. 72% of them had never heard from a Democrat or a Republican. And we're doing that now with the Latino community. So all of our voters, we tag them not just as Latino, but as Colombian, as Venezuelan, as Dominican, as Salvadoran, Honduran, as Mexican American, Tejano American, because that's how the communities are organized. If you go up to any Latino in our district and say, do you know another Latino? The chances are very small. But if you find a Venezolano, you can get to another Venezolano within 2 or 3 degrees of separation, because those communities are so tightly organized. And so by working through the networks of communities, it's not even about the language that they speak. It's good that we speak, some of us speak Spanish, and we communicate in Spanish, but that's not enough. Sometimes it's just that first line of connecting, saying that I see your community, just the way that if you walked into a Black church and you didn't know anything about African-American culture or history and say, come vote for me right before the election, people are going to look at you with skepticism. But if you're actually doing that work, if you're in the community talking to and especially listening to each one of these communities and what their specific needs are, not just painting them as concerned with one issue, that's how we actually get the communities to turn out in huge numbers. And I think that's what you're going to see this year.
Jalisa, were you going to add something?
Yeah, I was just going to add, taking it a step further, even on these campaigns, Democrats are raising and has raised record numbers of money, fundraising money on these campaigns. And it's important that we're messaging to these communities in a way that they understand and not just get these consultants who, don't have any culture competence when talking to these communities. It's one thing that I've been advocating for, and I know a lot of elected officials, especially at CBC, at CHC, have been pressing upon like the Biden campaign, a lot of these congressional campaigns. Hire consultants that look like the community that you want to talk to. Hire them to do the creative, the radio ad, the TV ads when talking to these communities. There's a level of culture competence that's needed, and voters look at that. They know that when they're seeing these ads and hearing these ads. So it's very important. Was something that I always try to hit on or try to be a part of any campaign that I work on. And I think we are seeing in this election cycle, particularly with the amount of money that we're raising in these congressional races, these presidential races. And it's something we have to continue throughout the election cycles.
Yeah, to Jalisa's point, and I mentioned it earlier, in regards to clinical trials, it's the same thing. Politics, you can just swap and change. Community validators, though, who has the trust of the community. So whether it be politics, a clinical trial, or asking for someone's vote, you're going to go into the church, you're going to deal with elected officials that are trusted in those communities, whether it's, using as an example, lobbying Congressman VC. Congressman VC knows me, Congresswoman Robin Kelly knows me. So I have built up a certain trust level with them. So I feel comfortable in that, or as serving as a validator. The other thing I was going to say is, listen, to the point of and far from me to be an expert on Hispanic or Latino community, but Florida, to the point, there was a lot written maybe 2 weeks ago or said, because I think one poll came out that showed Biden not doing so well with the Hispanic vote. We all remember that, right? About 2 or 3 weeks ago. That was one snapshot. Just like the African American community is not monolithic, neither is the Hispanic community. As Congressman VC said, you have in South Florida, Cubans, Venezuelans, Nicaraguans, Colombians, but you also have in Central Florida, Puerto Ricans, Dominicans, just like you have in New York. So it's incumbent upon anybody running for office, Democrat or Republican. But since the Hispanic vote is overwhelmingly Democratic, it's incumbent from us as a party to reach out to those folks and say, what are your needs? Just like Shri said, what are your needs? We want your vote, and ask for it and work to get it. And it's no different than anything else.
Mm. So I guess kind of picking up on the topic of validation and being able to trust the people who reach out to you and who, the elected officials who come to your communities to speak to you, I guess given the health of our commander in chief, who is supposed to be the person that you can look to and trust and rely on the things that they say, given his health, how do you think people will respond to his illness and the actions he's taken since his diagnosis?
Yeah, that is, I think that people are going to react to him negatively. And I don't know if you just saw, if anyone got the alert, but now the Joint Chiefs of Staff are going to have to quarantine because a high-ranking Coast Guard official has just tested positive for COVID-19. And so now, in addition to people being concerned about their health, you have to throw in, has our national security been compromised? Because, Iranians, Russians, whomever it may happen to be, that are hostile or aggressive towards the United States, might see this as an opportunity, not necessarily to go to war with us, but to certainly maybe flex their muscle a little bit in a certain region where they want to be seen by other people as being strong now, and being able to show that America is not in a good place to be able to respond. And so we have to, again, not only be concerned about our health and the fact that the president has really fumbled this and politicized this to where it's gotten out of control, and he can't even stop it from spreading within his own administration, but it's actually affecting our standing and national security in the world.
I think it's going to affect us in one big way, in that there's so much misinformation and disinformation being spread, a lot of it from the White House, unfortunately, around this pandemic, so that you get people who don't know what to trust. They don't trust their media. They don't have any trusted source of information. I talked to a physician a few weeks ago. He said for the first time in his life, he diagnosed a patient with a disease who said, well, you're just trying to pad your numbers because you don't like the president. That's a horrible place to be in for any frontline healthcare worker, where you don't even have the trust of your patients because of this being spread. And so I think the fact that it's now come home to roost, that the president and his inner circle now have been infected, hopefully that will dispel some of this aura of disinformation that's been spread, and these people who think that this is a hoax, and people will come to realize this is not a hoax. This is the greatest national challenge we've ever faced, and we need to take it more seriously than it has been taken by some of our politicians up to this point.
I just want to remind the audience that you can always put a question in the Q&A box down below, and I'd be happy to read it and see what our panelists have to say. Jalisa, did you have anything on that one, or?
Just the same, what everyone's been saying. I think, when we do win the White House back, because I do believe we're going to win, Democrats are going to win, that's going to be another factor that we have to add into all the other things that we have to correct with this administration, is building trust with the American people. My grandmother, we were talking about this the other day, she doesn't remember a time when people didn't believe or trust healthcare professionals or their government leaders. It's a scary place to be in, but I think it's, once we do get leadership back where it needs to be in this administration, we can start building that trust back with the American people. It's just a scary place to be in right now, especially in the middle of a pandemic.
So I guess, where do you see undecided voters making their decision? Where do you see Vice President Biden's campaign and his treatment of COVID, and having, the president says he's always wearing his mask as a prop, but then, the folks who are undecided that are looking at the president and his recovery, his miracle recovery, he's bounding up the stairs. How do you see that playing with undecided voters?
Look, you know what? I love when I go and I see MSNBC or CNN and they have this panel of undecided voters. My goodness, who the heck is undecided? Really, honestly, are those people seeking attention? I mean, what data point are they looking at that we're not seeing? That's a rhetorical question. Look, thank God Joe Biden is our nominee, and I'm just speaking for myself, and it's not Bernie Sanders or Elizabeth Warren, because we would have blown a opportunity to win this election. The country is in the middle. I don't have to tell Congressman VC and Shree who's seeking. I mean, if we're going to play in states like Texas, which we better as a party moving forward and, continuing the growth that we've continued to make in states, Jalisa knows, South Carolina, Georgia. I mean, my God, Georgia pick up opportunities, Arizona. We must govern from the center. And one of the things I love about VC and Congresswoman Kelly is the fact that they find common ground. I'm from the school when I worked on the Hill. I remember my former boss saying, Meeks is like Steny Hoyer say, hey, agree on 80%, cut the deal and fight the other 20% another day, and so on. And we have to just bring back some civility in our politics, getting along and saying, It was Congressman VC that said earlier in response to a question that some of his Republican colleagues, their daughter was impacted, and they may change their vote on the ACA. And if I'm misquoting you, I apologize. We have to find ways to work together and bring the country together. And I think under Joe Biden, that will occur. Under Bernie Sanders or Elizabeth Warren, we had zero chance. So we have to govern from the center and hopefully win the ideas, because they're good ideas on both sides. Politics is a contest. Win the elections and then govern from the center. And I hope that's the approach that we take.
Yeah, I'd like to echo what Mike said. I think the people that I talk to that find themselves in the middle, they are worried about extremism in our political spectrum, and they're looking to see who they can trust. So you've seen some of these ads come out from Republicans across Texas saying that if we elect Democrats, there'll be rioting and blood in the streets. There's no rioting going on in Sugar Land. There's no rioting going on in Houston, but there is a pandemic going on, and everybody knows it because everybody knows someone whose family's been affected, especially in Black and brown communities, which have been 2/3 of the deaths of people under age 65. Everybody knows that their health care is on the table in this election because there's a lawsuit from Texas to take away health care in the middle of a pandemic. And they know that now COVID-19 could be a pre-existing condition. And Texas has the second largest number of cases and the second largest number of deaths. All of those people, that's what's actually on the ballot. And so that trust issue about actual results, what has happened in their lives. If people see what's happened in 2020, they don't want more of the same in 2021. People are going to vote for a change. And that's what I hear from the independent voters, the people in the middle. They don't want a lot of extremism. They want reasonable politics that's going to bring them back to a normal life, because these are the people who don't want to be worried about politics every day. They don't want to open up Twitter every day to find out what our country is doing. They want to live their lives. They want their children to be able to go to school. They want their small businesses open again. And they want to make sure that their families are safe, and especially their parents and their grandparents aren't being sacrificed for someone else, like Lieutenant Governor Dan Patrick said. He didn't ask us whether our grandparents wanted to sacrifice themselves or not. And the independent voters I talk to, they see who's actually telling the truth to them, who's standing up for them. And they also see who's trying to take away their right to even have a choice, to even have their access to the ballot this year at the same time. And I think they're going to make the right choice.
Sorry about that. So I'm going to read a couple of the Q&A questions, and then we'll move on to last thoughts. One attendee has asked, do you believe that Biden being elected will be a cure to the mistrust? What would be the safest way to introduce responsible behavior for this pandemic without riots starting, as we require the wearing of masks? I think generally they're trying to, Mr. VC.
There we go. I think that Biden being elected would definitely be a step in the right direction, but it's going to take some work to build the trust back up. I don't think it's something that just like instantly happened. There's going to have to be a lot of trust to build it back up, and some of them will never, some of the people, particularly some of the Trump supporters, will never be trustful. But it's still going to be important to reach out to them and try to get them on board, and to get them to see that this is real, that what we're going through is not like a hoax, and that 1% of, because one of the things that you hear a lot from the people that are diehard Trump supporters is that, only 1% of the population is going to get sick. But if 1% of the population out of 370 million people, however many people we have in our country now, imagine all of those people overwhelming our healthcare system, our hospital beds, not being out of capacity to take care of their families, making other loved ones sick. That 1% of the total population of the United States is actually a lot of people. And having someone that occupies as they say, the bully pulpit, that will use it to bring us together, I think is really going to be important. But it's not going to be something that's going to instantly happen. It's going to be something that Biden will have to work on and be earnest about, and look the American people directly into the camera. So it looks like he's looking directly into their eyes and tell them that that he's sincere about this. And he knows how to do that better than anybody.
I think one of the biggest differences is when we're facing a serious problem like this, it can't be solved by saying fake news or tweeting. We need somebody who's going to take the job seriously and is going to try to unite the country around a common challenge, which is what we face right now. And I think that trust level, people have it around Vice President Biden because they've seen him take the job seriously before. And so the very simple things that we need to do, it's actually not rocket science. The easy things we can do is, one, mask requirements. He's talked about that, a national mask requirement, which the president has refused to do. It could be the number one thing to save people's lives. Making sure we get PPE out to everyone who needs it. I've talked to nurses in the past week who still do not have PPE 6 months into this pandemic. That's unconscionable in the United States of America when other countries are handling this pandemic. Japan, they have about half the population of the United States crammed in the space the size of California, and they've had 1,500 deaths. The rest of the world knows that we are not handling the pandemic properly. And lastly, we need to have rapid testing, not testing that you get results back in 7 to 10 days, because that means that you don't know if you're infected in that time, you can't go back to work. We need to have rapid testing across the country within hours, like we have in most of our major hospitals, so that people can actually get back to work and we can get back to a normal functioning economy again. I think people see the difference in the approaches between Vice President Biden, who takes a serious problem seriously, and our current president, who does not, who plays games with people's lives, and people are tired of the games.
So one more Q&A question, and then we'll get to our final thoughts. Any advice on getting millennials to vote?
Talk about issues that are important to millennials. I think that will help millennials go out and vote. I mean, I know the student loan debt is hugely important. I know that climate change is important to millennials. I think talking with them about issues that are uniquely important to them, the same way how we talk to seniors, because we know that a very high percentage of seniors are going to vote. The same way how, if you go to, Miami, you have to, talk about, Cuba and what's going to be your Cuba policy. So coming up with different policies on exactly how to address issues that have pulled high for millennials, I think is going to be important. But again, I think also that is something that is going to take time. It's not something that you can expect to, see happen overnight either. But I do think that a high percentage of them are going to vote probably like never before, because I think that everyone is sort of unified in the fact that Trump doesn't need to be president anymore.
So I would include millennials and Gen Z actually in this, because talking to youth, I think, is extremely important. Our district, I think, has the number 16 youth voting power out of any district in the country. And so we've made a conscious effort to reach out to youth on issues that they care about, like the congressman said, like climate change. Like in 2018, when we had a mass shooting in Santa Fe, just outside of our district, we went to every single March for Our Lives, a rally that was held, and all of those students there, we recruited them. They started joining our campaign. And what we would do is we would circle the high schools and find registered voters who are 18 to 25 years old, but were registered around that high school. And instead of knocking on the doors, because we weren't going to get a 19-year-old by knocking on their door, we would take those to our interns in college and in high school and say, find them on Twitter, on Instagram, on Snapchat, gamify it, reach out to your own classmates or the alumni from your own high school, because you're able to get to them much easier and within 2 to 3 degrees of separation like we couldn't. And then secondly, making sure that you're empowering them. So if they care about racial equality, a lot of the people that you saw in the streets after George Floyd's murder, they were young people who care about this issue, and tell them that they can be empowered in your campaign. Right now, the presidents of the Young Democrats clubs of Fort Bend County, Brazoria County, and Harris County, the third biggest county in the country, which I cover, all 3 of those presidents are alumni of our campaign from 2018. I'm very proud of that. But the strongest message that I give to young people is this. When I was their age, I remember feeling jaded, feeling like the Republican Party, the Democratic Party, is it all corrupt? Maybe I care about these issues, but I don't feel strongly associated with the party. And I tell them that's okay. You don't have to feel strongly connected with the party. But if you care about these issues, if you want your agenda to be on the table, if you want to tear down the system, the best way you can do that is by bringing 10 of your friends to show up and vote in November, because both the Republican Party and the Democratic Party don't have a model which accounts for you showing up. And so just by showing up, you can break that entire system, and you can put the issues that your generation cares about on the agenda. That's how you get your representatives to listen to you. And it's a powerful argument for them.
Yep, echoing again what everyone is saying. Even I'll go a step further, even talking about what's going on right now. I mean, a lot of, I don't know the number off the top of my head, but a lot of millennials had to move back home because of the current economic crisis that we're in. And that's a big issue that folks are facing right now. Even the uncertainty around job security, it's a big issue. I think folks are paying it, millennials and Gen X people are paying attention to. So engaging them around, issues that are important, but also what are they feeling right now? It's an urgency to change this. We all love our parents, but we don't want to be with them forever. So it's important to talk about those issues and talk about, what the Biden-Harris administration would do to help them up, let them up to get Americans back working, but particularly millennials, and job security and home ownership, right? Like, home ownership is the lowest that has ever been among the 25 to 35-year-olds in this country. That's where we start building wealth, particularly among minority communities. So talking about issues like that and reiterating the importance will help turn out millennial and younger voters this election cycle. And like you said, too, empowering them in these campaigns and giving them a voice so they feel like they're part of the change that's happening.
Yeah, so look, this country's facing a lot of big issues. And if when Biden is elected and the Biden-Harris ticket, they have a lot of tough decisions that they have to make to get this country back on track. First of all, is coronavirus, but the issues that that millennials care about, and I would have to say, look, Voting Rights Act, that's something, with a willing Congress as a partner can be achieved. DACA can be done. I'm a little bit, because of the price tag, student loan debt and some other issues that were discussed and debated during the primary and campaign, only because, again, there's going to have to be other coronavirus relief packages. If Biden is elected, I think he's going to do an infrastructure bill. At some point, the spending reality is going to hit. And so, I just hope we can continue to educate these folks and say, one of the things that they scream about is about the crime bill, but put the crime bill in perspective and show the good things that the crime bill in '94 did. 100,000 new cops on the street, midnight basketball, which they may not relate to. Am I saying that the bill was perfect? No. But is any bill perfect? No. I mean, and educate them to what the environment looked like at the time, and why that bill was needed, and why that bill had broad bipartisan support. And I just think it's gotten, a little bit lost in the debate and the campaign, for these sound bites for those who are promoting that. But a lot of tough decisions to be made moving forward, and getting this country back on the right track and people working and protecting their health care is going to require resources. And I'm just not so certain that student loan debt is going to be one of those things. And I'm just speaking my own personal opinion, that's going to be on the top of the food chain.
Thanks, folks. In the 5 minutes that we have left, are there any last thoughts that you all have on healthcare in this 2020 election, the space where we are now, how COVID is going to affect the outcome, how we get back on track? Any words of wisdom, pearls of wisdom that you have for folks?
I would just say that we need to keep healthcare on the forefront of the American public's mind during this campaign season. We need to keep talking about pre-existing conditions and people being put back in the high-risk pools. I think that it was important to voters in 2018, and it's going to be in 2020, and that we need to continue to be innovative and how we figure out ways how to expand healthcare for the American public. We need to look at how we're going to improve the ACA. We need to look at how we are going to go around governors that don't want Medicaid expansion, like in my state, and how maybe we can what's the right word? The way how that maybe we can empower local municipalities when U.S. governors don't want to do the right thing and expand Medicaid, or coming up with some other way how we can reach people nationwide as individuals. But I think that that people's demand for healthcare is going to continue to be an important part of this conversation, and as Democrats, I think that we need to be leading it.
I'll say for my state, for Texas, we've been talking for years about building it into a battleground state. It was 16 points 8 years ago. It was 9 points 4 years ago. It was 2.6 points 2 years ago. And now we are within the margin of error between Vice President Biden and Donald Trump. And we have strong congressional races across the state, including ours, where we're up by 3 points right now in a 2-to-1 gerrymandered Republican district. We are literally the largest battleground state in the country. And it couldn't have come at a more opportune moment, because we are facing the biggest challenge of our lifetimes right now. We know that coronavirus is impacting our children's education, our economy, and our very lives right now. And we also know that Texas is the largest uninsured state in the country. Healthcare is the #1 issue of the most important election in our lifetimes. And Texas, if we actually care about making profound change, about pulling people together and rising to our greatest challenges, then we need to put our money where our mouth is. So I hope that people support the candidates who are actually pushing forward the agenda that's going to unite the country, that's going to actually deal with our problems rather than avoid them. Because on November 4th, we don't want to feel like we felt in November of 2016, where I was saying, I wish I had done more. On November 4th of 2020, all of us should be saying, thank God we did enough.
Yeah, I'll go. Making a plea, being a campaign person and making a plea for everybody to do everything you can to help us win this election cycle. As he said, we don't want to wake up November 4th and say, oh, I wish we would have done more. And luckily, well, not luckily, but a lot of us are home, and you'll be surprised a lot that you can do to help these campaigns by just getting on the phone and calling your circles. A lot of your professionals, health professionals, and your family look to you for advice when it comes to healthcare. So, talking to them about what's at stake with healthcare this election cycle, why it's important to vote, and even organizing folks either to vote early or to absentee vote or vote on election day is going to make the big difference. Volunteering with some of these campaigns, I know folks get tired of talking on the phone, but phone banking really do push turnout. So I would encourage all the panelists, I would encourage all the attendees today to do everything you can on top of your job to help us turn out folks this election cycle. And hope we have a different change on November 4th.
So I'll conclude by saying, look, several months ago, being an original New Yorker, and the pandemic, coronavirus came through New York via Europe, as Governor Cuomo has so eloquently pointed out, when the president has made, in my opinion, racist comments calling it the China virus. But put that aside. It's not the governor's job to manage global pandemics. That's the federal government's job, and Homeland Security in particular. And as you know, with New York being a major international hub for Europe, both Kennedy and Newark Airport, more than 3,000 flights came through Europe in the beginning months of this pandemic. And that's how it spread throughout New York City. But my overall point of being is that a lot of communities in New York, minority communities, weren't low income. A lot of them were middle class communities that got hit hard during this pandemic. So when you extrapolate that across the country, I think you're going to see record turnout like you've never seen before. You know how the president likes to say, oh, it's something like nobody ever predicted. It's going to be something like you've never seen before. I honestly believe that, because I think this has illuminated coronavirus, just the disparities in terms of healthcare, economic access. I mean, we're all fortunate to work from home, but those who are less fortunate, and honestly, look, through the grace of God, there goes I, and the expression. So hopefully, as Jalisa said, I already voted. I hope people exercise their right to vote and make their message loud and clear that the last 4 years of fanning the flames of racism and sexism and we need a new change. We need a change of direction. And I think that the majority of this country, which is a great country, a good country, is going to send a loud message November 3rd.
Thanks, Mike. And thank you to all of our panelists. You guys did a phenomenal job. I appreciate it, Congressman VC. Thank you to all of our participants today. We hope to continue having these conversations, and we'll see you all next year.
Thank you, Nicole.
Nicole, thank you.
Thanks.
Thank you, Nicole.